Mesothelioma is an aggressive form of cancer that develops from the mesothelium, which is a protective lining that covers many of the internal organs. Mesothelioma of the abdomen specifically impacts the peritoneal lining of the abdominal cavity. While the current standard of care for abdominal mesothelioma involves chemotherapy, radiation therapy, and surgery, there are also several alternative treatments being explored. However, it's important to note that there is limited scientific evidence supporting the effectiveness of alternative options for mesothelioma. Patients considering complementary therapies should always discuss them first with their medical oncologist. One alternative treatment being researched is immunotherapy. Immunotherapy seeks to boost the body's natural defenses to fight cancer. For mesothelioma, immunotherapies under investigation include therapies that block certain immune system checkpoints like PD-1, PD-L1 inhibitors. Clinical trials are studying if these drugs can be effective when used alone or in combination with standard mesothelioma treatments. Early results are promising, but more research is still needed. Turmeric and its active compound curcumin are also being studied for potential anti-cancer effects against mesothelioma. Preliminary laboratory research found curcumin may help suppress mesothelioma cell growth and induce cell death by interfering with several cancer-related signaling pathways and molecular targets. However, more clinical trials are still needed before conclusions can be drawn about the efficacy and safety of curcumin for treating mesothelioma in human patients. It is also important to note curcumin is poorly absorbed into the bloodstream when taken orally, so high doses are typically required. Other plant-based therapies receiving research attention for mesothelioma include ginseng, resveratrol from grapes, catechins from green tea, ellagic acid from berries, and apigallicadecan 3-galate, EGCG. For example, some studies found EGCG from green tea can inhibit mesothelioma cell proliferation by inducing apoptosis, programmed cell death, and resveratrol was shown to enhance the anti-cancer effects of chemotherapy drug carboplatin in mesothelioma cells. However, more extensive clinical research is still warranted before recommendations can be made regarding the usage of these plant products for treating mesothelioma in humans. Marijuana and its main active ingredient THC are also under preliminary research for mesothelioma. Lab studies found THC could potentially inhibit mesothelioma growth by preventing new blood vessel formation supplying the tumors, anti-angiogenesis, and also by disrupting important cancer-driving signaling pathways. Some small studies in mesothelioma patients even reported improved quality of life when marijuana was used for symptom management. However, prescription cannabinoids should only be used under medical supervision and more research is still needed to establish safety and effectiveness. Transitioning to a plant-based, Mediterranean-style diet has also generated interest for mesothelioma patients. Population-based studies linking vegetables, fruits, whole grains, fish, and healthy fats like olive oil to reduced cancer risk and mortality provided the rationale. Similarly, limiting red meat intake has been associated with better outcomes in some cancer patients. Certain phytochemicals found abundantly in plant foods are believed to possess anti-cancer properties through various mechanisms. However, no randomized trials have conclusively demonstrated significant clinical benefits of diet changes alone for mesothelioma. Diet should be viewed as a complementary approach rather than replacement for proven standard therapies. Overall, more high-quality research is still necessary to substantiate many alternative therapies for mesothelioma. Some may prove beneficial as standalone or adjuvant options, but current evidence is limited. Patients should discuss all treatment plans with their medical team. Targeted therapies continue showing most promise for improving prognosis in this challenging cancer. While alternative therapies are being explored for treating mesothelioma of the abdomen, the current standard of care based on chemotherapy, surgery, and radiation therapy generally remains the primary treatment approach due to established efficacy supported by scientific evidence from clinical trials. Further well-designed studies are still warranted to more robustly evaluate potential anti-cancer benefits and safety profiles of emerging alternative options like immunotherapy, nutraceuticals, dietary changes, acupuncture, and medical marijuana. Open communication between patients and oncologists will help ensure individuals have realistic expectations regarding unproven complementary therapies while pursuing the most well-supported current standard treatment protocols. Future research may eventually lead to some alternative approaches being incorporated alongside or in place of conventional options, but more data is required first before definitive recommendations can be made.